But sponsored by Dr. Stuart Leicht. Once again, it is time to meet your provider, and today we're here with Dr. Stuart Leicht. Good to see you, Doc. How are you doing?
Good to see you.
You have a very special guest with you today. Introduce us.
Yes, this is Candace. We're very proud to have her affiliated with our practice. She does our cosmetic procedures, and today she's going to talk a little bit about that, the Botox that she does, micro needling and fillers. She's very skilled, very well trained, and we think we offer an excellent service, but I'll have her describe that.
Thank you.
You're welcome.
Yeah, so I'm Candace Thomas. I'm a PA, so I've done cosmetics and dermatology since about 2017. Started out in Memphis when we lived there, did most of my training in Memphis. Then we moved to Asheville, North Carolina, and I worked there for several years in a big, very busy cosmetic office, and then now kind of back in the Tri-Cities doing some here. So like Dr. Leicht said, we do Botox, we do fillers, we do skin vive and microneedling. So just a kind of a small splattering of everything. We mainly use Allergan products, but they all work well. And we also offer individual like skincare consults. So if you're not sure what the difference is between Botox or filler, or what the difference is between microneedling and which one you need, then we have you come in, we do kind of a full facial assessment, see what your goals are, what you're trying to get done, and which of those would be best for you, and kind of risk benefits versus each one of those, because they're all different. Yeah.
Do you get a lot of folks coming in with questions like, I want to look better?
Yes. So that's kind of the most common thing is they come in and they say, I don't know really the difference, or if I want Botox or filler or microneedling. And I'm like, well, what bothers you? What is it, what is that is? And most people want just to feel better and look refreshed. Nobody wants to look like they've had Botox done. I always say good Botox and filler, you don't look like you've had Botox and filler. You just look more refreshed and kind of still like you, but well rested. So
who are good candidates for Botox and filler?
So anyone is a good candidate for a Botox and filler unless you are actively pregnant or you have a history of neuromuscular diseases. And I always say if you don't know if you have a neuromuscular disease, you probably don't have one. But everyone else is open to it. You do want to be like an adult, so 18 and up, but anyone else. But we do offer microneedling services, and microneedling services are great for acne scars. So you can be a teenager if you have bad acne scars, and that could be beneficial for any age group, kind of from the teen years up.
Kind of walk us through microneedling.
Yeah, so it's kind of exactly what it sounds like. There's a bunch of teeny tiny little needles in this pin. I kind of described it. It looks like a tattoo pin. They go in and out of your face. We put a numbing gel on your face before we do it, so it is not painful. It sounds kind of horrific, but with the numbing gel, it's not painful. Those needles then go in and out of the skin at a really fast rate to kind of break down scar tissue, stimulate collagen production, kind of the micro injury of it all. And we offer the skin pin, which is the only FDA approved microneedling device that's been tested and regulated.
You mentioned something there. You want to make sure people are very comfortable.
Yes.
I know a lot of people, when you start mentioning needles, they get a little uncomfortable.
Yeah.
But you're putting them at ease.
Yes, so we have we don't want to do anything you're uncomfortable with. We have lots of ways to ease your comfort, whether it's just an ice pack, anywhere from that to numbing gels and different things like that. Because it hurts. I usually say it's a little spicy, but it's not. It shouldn't be painful. Yeah.
I like how you put that.
Yeah.
Just a little spicy.
A little spicy, but should be painful.
What is the most common question you get from new clients, especially?
New clients mainly want to know what they need and what would be best for them. And one thing we always talk about is facial balancing, because you really want your upper face and your lower face in the same decade. So you don't want to just focus only on Botox and you have this super smooth forehead and then you look your neck and everything else shows your age. But so just kind of facial balancing is the most, which is what most people are looking for, is just kind of you tell me what I need, essentially. Kind of thing.
Now I know there's viewers out there right now kind of on the fence.
Yeah.
Whether they should come in.
Yeah.
What advice would you give them?
Come in and we'll chat about it. I will never pressure you to do anything. If you come in and you decide, yeah, that sounds interesting, but this isn't for me right now, then that's fine. That it's not for everybody, and that way if you do want to do it or not. Because if you don't know, then you don't know kind of what the difference is and what's available and what can be done.
All right, doctors. Sounds like you've got a great group of people working here for you that are putting people at ease and getting the services they need.
We think so. Again, we think we gel very well here. Patients seem to enjoy it. We offer a broad range of services. And most particularly, I think we're excellent in what we do. A lot of people gauge their physicians by how much they like them, but that doesn't correlate with their effectiveness or excellence or clinical acumen. We like to think in this clinic that we include all those various criteria.
Candace, Dr. Leicht, thank you so much for taking time with us today. And folks, that's this week's Meet Your Provider.
The preceding segment sponsored by Dr. Stuart Leicht.